Imagine this. During only 1 hour of walking, our feet take on a force equal to roughly 450 times our body weight. That is a huge, truly impressive amount of pressure, especially when we remember how complex the foot actually is. It contains 26 bones and 33 joints. Because our feet work constantly and carry us every single day, it is not surprising that different types of foot pain may appear over time. In this video, we will look at 5 common reasons why the feet may hurt and explain what can be done in each case. The first condition is heel spur, or plantar fasciitis. In daily speech, people often call this problem a heel spur, but medically, it is more accurate to call it plantar fasciitis. Very often, the pain begins unexpectedly. One day, everything seems normal, and the next morning, a person gets out of bed, steps on the heel, and feels a sharp pain, almost as if they stepped on a small, hard object, like a Lego piece. After a few steps, the foot starts to move, the tissues warm up, and the sharp pain becomes less intense. Still, some discomfort may remain during the day. A common situation looks like this. A person sits for some time, for example, at an office desk. While sitting, blood flow in the heel area becomes more stable. But as soon as the person stands up again, the same painful feeling returns, as if something sharp is pressing into the heel. To understand the reason, we need to look at the structure.
It is important to understand that this bony projection is not always the real source of pain. More often, it is the body's reaction to long-term irritation of the plantar fascia. Diagnosis usually includes the patient's history, a physical examination, and X-ray imaging, where this bony growth may sometimes be seen. The name heel spur became common because the shape resembles the spur seen in birds, such as roosters. But from a medical point of view, the main problem is inflammation and microtears of the plantar fascia. The second cause is a stress fracture, also called a March fracture or Recruit's disease. Stress fractures most often occur in the second and third metatarsal bones. This condition is known as a March fracture because it often develops after long walking or repeated heavy loading. A classic example is soldiers walking long distances with heavy equipment. One important feature is that in the early stage, an X-ray may not show any visible fracture, even though the person already feels pain. Only later, when the bone begins to heal, a bone callus may become visible on imaging. A stress fracture is not a complete break of the bone. Instead, tiny cracks appear inside the bone. It is similar to bending a fresh green branch. It cracks inside, but does not fully break apart. Because there is usually no displacement, early X-rays may look completely normal. Typical symptoms include slight swelling in the front part of the foot and pain. During examination, pressure on the head of the second or third metatarsal bone usually causes clear tenderness during examination. At an early stage, MRI is much more useful than X-ray because it can show bone marrow swelling around the injured area. The third cause is osteoarthritis of the foot joints. The joint most often affected is the first metatarsal phalangeal joint, which is the joint of the big toe. Osteoarthritis in this area is not only connected with cartilage wear, it is also associated with the formation of osteophytes or bony growths on the head of the first metatarsal bone. Over time, this enlargement limits the movement of the big toe. When the toe tries to bend during walking, it comes into contact with the bony growth and causes pain. In other words, a mechanical conflict appears between the bones. Normally, when we walk, the foot rolls forward and the big toe bends. But with osteoarthritis, this movement becomes restricted and pain appears. To avoid pain, a person may unconsciously change the way they walk, shifting weight to the outer side of the foot. This can lead to overload, limping, and additional discomfort. The fourth cause is flat foot or peasant.
Symptoms may include burning, pulling, tearing-like sensations, or dull aching pain. A very common complaint is that in the evening, after taking off shoes, a person feels as if their feet are burning. Flat foot often affects both feet. This condition usually develops slowly, and people gradually adapt by becoming less active. However, As it progresses, stretched ligaments and changed foot mechanics may also affect the lower legs, knees, hips, and even the spine. The fifth cause is hallux valgus, commonly known as a bunion. Hallux valgus is a deformity of the big toe. The first metatarsal bone shifts outward, creating an angle between the first and second metatarsal bones. As this angle becomes larger, the deformity progresses. Because ligaments and tendons are attached to the big toe, the toe itself also begins to move outward. This creates the typical visible bump. The result may be tension, inflammation of the joint capsule, redness, and pain. Sometimes patients say that their fourth and fifth toes rub against their shoes. This often happens not because those toes are deformed, but because the bunion pushes the shoe outward and increases pressure on the smaller toes.
Now, let's talk about how to reduce pain and inflammation before visiting a doctor. Self-treatment is not the best solution, but until you see a specialist, you can take several simple steps. First, reduce the load on the foot. Avoid high heels and tight shoes. Choose comfortable sneakers with soft soles. Second, wear shoes that fit properly. Footwear that is too narrow or too small often makes pain worse. Third, avoid iodine grids. They do not solve the problem, and if used too often, may even cause skin burns. Fourth, pain-relieving and anti-inflammatory medicines may temporarily ease symptoms until you receive medical evaluation. Now, let's briefly review treatment approaches. For plantar fasciitis, treatment may include custom orthopedic insoles, special foot exercises, massage, improved blood circulation, and shockwave therapy. Hormonal injections can reduce pain quickly, but they may weaken tendons and increase the risk of recurrence, so they should be used carefully. For hallux valgus, toe separators, corrective devices, exercises, insoles, and taping may be recommended. In advanced cases, surgery may be necessary. For osteoarthritis, conservative treatment usually helps reduce symptoms, but surgical treatment is often needed to correct the underlying mechanical problem. For a stress fracture, the main goal is to unload the forefoot, reduce activity, and in some cases use immobilization. For flat foot, custom insoles are often combined with therapeutic exercises. Strengthening the muscles of the foot is very important so that the person does not become dependent on insoles alone. And finally, if you have foot pain and want an accurate diagnosis and effective treatment, it is important to consult a specialist. Thank you for watching until the end. Subscribe to the channel and share this video with anyone who may find it helpful.